Well, we had a number of questions on progression of disease and what are the signs and symptoms, as well as why does the lower esophageal sphincter fail, and even where is the lower esophageal sphincter and where does the Lynx device go. So the answer is the lower esophageal sphincter is right back here, right behind the lower part of your sternum, what's known as the xiphoid process. So whenever we do these operations, we're operating right behind here in the dome of the diaphragm. And progression is due to lower esophageal sphincter failure. And why this fails, actually, we do not know. There is a lot of research in there, but I can't tell you, and no one really can tell you why the sphincter fails. We believe it has to do with persistent damage, but we don't know why it makes it weaker, it makes it shorter. We know why when you have a shortened, weakened lower esophageal sphincter, you're going to get more symptoms and GERD, but we don't know why what the mechanism is. What are those signs of progression? Well, number one, if you have an endoscopy and you're on medical therapy and they say, well, I'm sorry, you've got Barrett's esophagus or you have esophagitis, even though you're on medical therapy, that's progression of disease, easy progression of disease. Some other things that you can look for as a patient are worsening symptoms despite medical therapy. So the medications were working for a period of time and then now they're not, or you're having to escalate your dose from single dose medication to double dose medication, and some people are even on double dose medication in the morning and double dose medication in the evening, which is a sure sign that you're progressing in your disease, failing sphincter. Next, nighttime symptoms. Patients can often be doing okay during the day, but then when they lie down at night, they're getting significant symptoms, especially regurgitation. So sometimes the acid is gone, the pain goes away, but they're waking up choking and things like that. I can tell you that that's what I used to do. That was my first warning sign. Certainly developing dysphagia, as we discussed earlier, while on medication, bad sign, need to have an endoscopy right away. So escalation of dose and recurrence of symptoms or worsening symptoms while on medication or any of those alarm symptoms that we talked about earlier, those are sure signs of progression and you need to get diagnosed and get evaluated quickly.